And I am coming to you live today from Oak Street Clinic in Burton, Michigan. This is your Medicare Minute, 12 noon, and I'm hoping you can still hear me. Yep, okay. Anyways, I wanted to say thank you today to Navigate Home for having me on the live broadcast today. And thank you to Kim Russell and Valerie McBain. Today, the Medicare Minute, we're going to talk a little bit about COVID-19, and then we're also going to talk about a Medicare plan called Extra Help or Low Income Subsidy that can help people on Medicare with their prescription drug costs and some other things. So first off, I wanted to tell you a little bit about me. Again, Belinda Alio. I'm with Medicare Choices, and I'm a Medicare health plan specialist. My specialty is working with people on Medicare and also people on disability who receive Medicare. I also work with people on Medicare and Medicaid, get into plans called dual enrolled plans. So first of all, today I was checking out the COVID-19 Michigan website and found that 45% of our Michigan population has now been vaccinated against COVID-19. So sometimes people have questions still about where they can get a COVID-19 shot. And of course, many of the local pharmacies are providing shots. You can register online. Also, if you can't figure out where to go, you can always call the COVID-19 hotline at 888-535-6136. The Michigan Department of Health and Human Services also has a hotline you can call, and that is 888-535-6136. It's also the same number, COVID hotline or Michigan Department of Health and Human Services. And then you would press option 5, and they can help you get something scheduled. Another thing that people have asked me is whether they have to pay for their COVID vaccination. And the answer is no. No matter where you get it, you do not have to pay for it. There will be no co-pays involved. They may ask for your insurance card, but you will not be billed. Okay? So that's pretty much your COVID update for today. The other thing I wanted to discuss today is the Extra Help program, Low Income Subsidy. And this is something that a lot of seniors don't know about who are on Medicare. And you can apply for Extra Help or Low Income Subsidy, which will help pay some of your prescription co-pays or lower your prescription co-pays. Also helps you with monthly premiums for prescription drug plans. It can also help pay annual deductibles for your prescription drugs. So in order to apply for that, you can go to ssa.gov/extra help, or you can contact me and I'll give you my information at the end of the program. What Extra Help does is it takes a look at your income and your resources and then decides whether you qualify to get this extra help to lower your prescription drug costs, co-pays, premiums, etc. And this year in 2021, your resources as a single person would have to be $14,790 or less. And resources include things valuables such as real estate, bank accounts, checking, savings, CDs, stocks, bonds, mutual funds. So if your resources are $14,790 a year or less, you would likely be able to qualify for that side of the extra help. Now, your income, that would have to be limited to, for 2021, $19,320 or less per year. For a married couple, it would be $26,130. And they do not take into account your home, your possessions, or your car, which is a really wonderful thing. So, for instance, one of my aunts, we talked about Medicare, and she said she was really having a hard time making ends meet. So we applied her for extra help, and I did that for her right from my computer. You can also do it from your computer or by calling a number, and I will give you that information in just a minute. So as you're filling out the application, it'll ask how many people live in the household, all your information. Then it will ask you what your monthly income is, you know, whether you receive Social Security, a pension, some type of a payment from an investment, whatever it might be. It's going to gather all that information, then it's going to ask you about resources, and then they'll determine whether you're eligible for this. If you are eligible, you can be referred on to a program called the Medicare Savings Program. That program would eliminate either partially or in full your Part B premium each month. When you're receiving Medicare, you have to pay a Part B premium every month, whether you are or are not on Social Security. And this year for 2021, that fee is $148.50 a month. So when I applied my aunt, she was so surprised because when she got her letter of determination, she received the extra help, so the low co-pays for her prescription drugs, and they eliminated her Part B premium. So she had an extra almost $150 per month in her paycheck, and that really helped her out. Some people ask, well, what type of co-pays will I have if I, am granted this extra help, low income subsidy? Well, there's 3 levels of payment for that extra help, and the highest one, people that would get the largest subsidy would pay 0 copay for both generic and brand name drugs. And then the next level, they would pay $1.30, and then the next level, $3.60 a month to fill a prescription. So as you can see, it's super beneficial. It can save people a lot of money. I know people who are on standalone drug plans, people who have Medicare supplement, and they've had $25 a month of their premium just knocked out with this extra help program. So I want to give you the website again to apply for extra help. And even if your income is close, it might be even a little more than what I have just spoke to you about, you can still go online and apply at www.ssa.gov/extra help. You can also call Social Security at 1-800-772-1213 and apply over the phone. Or you can request a paper application be sent to you. So there's many ways to take care of this. Also, if you're a person who turned 65 and never acquired prescription drug coverage, you know that you are exposed now to the late enrollment penalty. which will build up every month that you go without your prescription drug coverage. So if you apply for extra help and you're granted that extra help, you won't pay a penalty. It is eliminated. So it's a really wonderful thing to apply for, especially for someone who hasn't had or couldn't afford prescription drug coverage and you have a lower income. It gives you a great opportunity to get your prescriptions covered at a very, very low copay. Again, my name is Belinda Aleo. I'm with Medicare Choices. If you need to get a hold of me at any time, I will post my name and number after we complete this video, this live video. And also, you can telephone me at 248-318-5866. Thank you, and I hope you have a blessed day.